Hi, I'm Garrett Forrest. I'm the PA with Cool Springs Plastic Surgery here at Music Row. We're with my lovely patient Veronica today. We're going to be showing her cheek filler treatment. As we discussed earlier, this patient she's thin and she's worried about volume loss in her mid-face area. We're going to be using a Juvederm product today called Voluma that was originally developed for cheek enhancement. This product lasts about 2 years, and we're going to be injecting directly down to bone on her zygomatic arch today to help fill in this volume loss, which also, as a nice little bonus side effect, can give a lifted appearance to the nasolabial folds and marionette lines. So she's been numbing for about 10 minutes, and we're going to clean her off with chlorhexidine just to sterilize the area. A lot of patients ask about pain during this filler procedure. It really depends on the area. Cheeks in particular, I find personally, are not as painful as some other areas. It's pinchy, it's a needle stick, and you can actually hear the injection sometime because we're close to the ear and it can sound a little crunchy. So I'd say it's more disconcerting than it is painful. Are you ready, Veronica? I'm gonna give you a little squeezy ball just in case. Smile for me. Big cheesy smile. Good, good, good. All right, and relax. Okay. Big deep breath. 1, 2, 3, pinch. Good. How was that? Not too painful?
Nope.
Did you hear any crunching?
Maybe a tiny bit.
Okay. Deep breath. 1, 2, 3, pinch. Good job. So I'm letting the needle very, very gently hit periosteum, which is the top layer of this bone here, and just slowly injecting. And it's pretty instant. She had a little bit of volume loss right here in the center, and we've corrected that now. You really want to have light reflect in a nice curved pattern here versus before when she had a little shadow here. It disrupted that reflection. So we're trying to get that C curvature right back into her cheeks. I'm going to come a little lower now. So deep breath, pinch. How are you doing pain-wise?
Great.
Okay. Deep breath. 2, 3, pinch. Good. Now what I'm doing with my left hand when I first put the needle in, I'm aspirating or pulling back on the plunger. It's a safety measure that helps us prevent something called occlusion. If you aspirate or pull back on the plunger and you see blood come back into the syringe, you know that you're inside of a vessel and not to therefore inject filler into that vessel. Okay, cheesy smile for us. Beautiful. See the difference between this cheek and that cheek. Smile again. See how she has that little gap there, that disruption in the reflection of the C curve on this left cheek. And on this right cheek, we have a nice natural round curve. Now, a lot of people are afraid when they're getting cheek filler that it's going to make them look cheeky. It actually does the opposite by lifting these lines that can make you look a little cheeky. So I'm going to take a break on this side and hop over there and do the same thing on the right side. So I've changed my needle just to make it more comfortable for the patient, and I am going to start doing the same thing on this right side. Now this patient actually sleeps on her right side, so she has a little more volume loss here. So I've saved a little bit more filler just so I can make sure that we're symmetrical. Okay, deep breath. 1, 2, 3, pinch. Beautiful. You okay? Good. The filler is fairly malleable immediately after we inject, so I can actually massage and manipulate it into the area that we like if I don't get it exactly where it needs to be with that injection. Okay, deep breath. Pinch. Good. So far so good? Feeling okay? And see, with those 2 little injections, we already mostly corrected this hollowing she had here that was catching a shadow and aging, giving a more aged appearance. So we're giving a more youthful look by just replacing volume that she's lost. That's a really important feature of doing filler. We never want to add volume where someone didn't have it before in the cheeks. We're just replacing volume that they've lost over time. That is the key to a natural result. Okay. Deep breath. 1, 2, 3, pinch. Good. Okay, I'm going to stop here for a second and turn the lights on and take a good look before I finish this syringe. Thanks, Sherry. Okay, now I'm going to have the patient sit up so we can see what gravity does for us and have her smile and relax and smile again. And you can see she still has some volume loss here. So I'm going to continue to correct so that we get that continuous light reflection. Smile again. And you can still see the difference between this cheek and that cheek. Again, she has more volume loss on this right side just because of her sleeping patterns, so we'll continue to correct that. Okay, deep breath, 2, 3, pinch. Good job. You hang it in there. All right, we're close to full correction there. Okay, smile again for us. Beautiful. So we still have a little work to do on this right cheek, and I may, when she comes for her follow-up in 2 weeks, we may discuss doing another syringe of Voluma. We wanted to start with 1 just because this is her first time and she is very thin. So we certainly don't want to overfill her and make her cheeks look unnatural. So we're gonna stop here, but at follow-up, I have a suspicion that we're gonna want to do another syringe just to create more symmetry on this right side. So that's it. Thank you so much, Veronica.